It is not as though most people choose to ignore the signs and symptoms of colon cancer. Many of them are often undetected, and others may be readily ascribed to other conditions. For example, as a person progresses through the stages of colon cancer, the symptoms of a colon tumor may be similar to those of hemorrhoids, ulcerative colitis, ulcers, or Crohn's disease. It may be relatively easy to overlook the early warning signs of colon cancer, since most people avoid seeing a doctor. Thousands of people are at risk because colon cancer symptoms often go unnoticed without medical testing. Often, it's too late when symptoms first appear. In the United States, colorectal cancer is the second highest cause of cancer-related deaths overall, and the third leading cause of cancer-related deaths in men and women. It grows slowly, with symptoms of a colon tumor often not appearing until they are quite large. Eventually, the tumor will pierce the intestinal wall and may cause bleeding, which is occasionally invisible to the naked eye and can only be detected with microscopic fecal matter testing. When the cancer spreads, it often does so through lymph nodes but can also spread to distant organs like the liver, brain, and lungs. We're going to talk about some early warning signs of colon cancer that you shouldn't overlook before we get started. Please remember to like and subscribe for more bold changes. In 2022, it's predicted to cause about 52,580 fatalities. It is typical to experience gastrointestinal issues occasionally. Everyone occasionally experiences diarrhea or constipation, so these conditions are perfectly normal. However, if you've noticed persistent changes in the frequency of your bowel movements, this may be a sign that you have colon cancer. Colon cancer affects the entire colon, whereas cancer of the rectal region only affects the bottom part of the colon. Regular diarrhea, constipation, and incontinence are common symptoms of colon cancer. Blood. Blood in the toilet bowl or on the paper after wiping could be an early sign of colon cancer. But this symptom is also commonly associated with conditions like Crohn's disease, hemorrhoids, ulcers, or ulcerative colitis. If you are unable to use the restroom or find that you are using it suddenly, it may be a sign of colon cancer. Blood stains on your underwear or widespread rectal bleeding, not only in your stool, may be an early indication of a colon tumor. Bleeding tumors usually indicate that they have expanded, which opens the door for the development of other symptoms. For the aim of early diagnosis and improved treatment efficacy, it is imperative that you see your primary care physician at least once a year or more frequently if they recommend it. Regular cancer screenings are also crucial. Inexplicable drop in weight, unintentional weight loss, is frequently the first indication of a number of illnesses, and it is also rather common among colon cancer patients. Roughly 40% of cancer patients show symptoms. The worst part is that patients may experience cachexia, a weight loss complication that is accompanied by a loss of muscle mass. Cachexia may also make other cancer-related symptoms worse, though weight fluctuations are not always a sign of serious illnesses. There are many ways in which cancer can cause a change in weight. Some specialists believe that malignant cells may use up the majority of the body's energy supply. They may also alter the body's metabolism or energy production from diet. Another interesting factor is that cancer often affects patients' appetites, and those who lack appetites tend to consume less food than normal, leading to weight reduction. Even the majority of cases are unrelated to colon cancer again. Instead, it is associated with several disorders. Although anemia is strongly linked to cancer, the exact cause of the anemia may vary depending on the type of cancer. Symptoms of anemia are often mild and go undiagnosed. A person may experience fatigue, lethargy, difficulty focusing, or shortness of breath after engaging in moderately intense exercise or physical activity. When the colon is damaged by a certain type of cancer, such as bone marrow cancer, the body's ability to produce red blood cells is directly impacted, leading to severe anemia. Bleeding is regarded to be the most prevalent cause of anemia. Cancer fatigue differs from ordinary fatigue, such as the kind you experience at the end of a long day or when you don't get enough sleep. This is because the tumor secretes substances that encourage the development of new blood vessels as it grows. These substances cause blood vessels to rupture, which results in the loss of red blood cells. This bleeding may result in an iron deficit, even if there is sufficient iron in the blood. The inflammation in the surrounding area may cause iron molecules to get stuck in immune cells. As a result, the availability of iron decreases, causing iron deficiency anemia to develop. Cancer fatigue can persist for several days or even weeks. It can leave a person feeling worn out even after a restful night's sleep. And overcoming this fatigue with coffee or determination is ineffective. The following signs of exhaustion could be a sign of colon cancer early on. A strong sense of exhaustion that is sometimes called full-body fatigue. This kind of exhaustion is unbearable to treat and is felt during even the most mundane tasks, like going to the mailbox. It also makes it difficult to focus on tasks and makes you feel more emotional than usual. It also appears earlier than usual and reduces your desire to do things. Constant abdominal pain from colon cancer usually manifests as cramps or niggling in the abdomen. The exact location of the pain varies depending on the colon's affected region, the size of the tumor, and the extent to which it has spread to other parts of the body, a condition known as metastasis. For example, if the cancer has spread to the liver, symptoms like pain in the upper right abdomen may be felt. It is not always clear whether the pain is coming from the colon. Because the colon is located in the abdomen, any discomfort there could migrate to other parts of the stomach. It starts on the left side of the belly and moves all the way up to the right before returning to the left. And inflicts suffering elsewhere. Food is passed through the colon by the contraction of its muscles. This part of the digestive system is in charge of absorbing water and a few nutrients from the food that is consumed. If there is irritation, inflammation, or a blockage in the colon, you may experience discomfort as well as other symptoms. As the old saying goes, prevention is better than cure if there is insufficient blood supply to any part or all of the colon. What can you do to prevent this crippling and deadly disease if cancer runs in your family, or if you have a medical condition that raises your risk of getting a particular type of cancer? Understanding your risk factors is essential. Being proactive and making healthy lifestyle choices can help lower your risk of developing cancer. For example, studies show that regular moderate exercise reduces the risk of cancer by at least 30%. Make an effort to exercise for 30 minutes each day. You should also maintain a healthy, balanced diet that includes plenty of fresh fruits and vegetables, low-fat foods like olive oil, and little to no red meat. Finally, quitting smoking can lower your risk of developing cancer by 15 to 30 times. Limiting alcohol consumption to 1 drink per day has now been shown to reduce the risk of heart disease and other health issues. However, drinking too much alcohol can increase your risk of developing other cancers. It has been demonstrated that smoking and binge drinking increase the risk of oral cancer. Colon cancer and esophageal cancer get some sun exposure because research indicates that high blood levels of vitamin D may be linked to a lower risk of colon cancer. Researchers came to this conclusion after examining data from 7107 healthy adults and 5706 patients who had colorectal cancer. They found that women with the highest levels of vitamin D had a statistically significant lower risk of colon cancer than those with the lowest levels. The risk was lower for men, but not statistically significantly. A systematic review and meta-analysis published in 2015 suggested that the B vitamin folate, which can be found in foods like spinach, asparagus, and fortified cereals, may lower the risk of colon cancer. But there is conflicting data, so more investigation is required. For most people, 400 micrograms of folate per day in cell culture is the recommended amount. In addition, a 2012 population-based study involving 2,664 individuals suggested that dietary quercetin may be linked to a lower risk of proximal colon cancer. These findings support the notion that quercetin, an antioxidant found in tea, may prevent the development of colon cancer. The results of these experiments were obtained in a laboratory. This correlation was not found in people who consumed a lot of tea or for colon cancer in the distal colon. Quercetin is found naturally in foods including apples, onions, and berries, and is also available as a nutritional supplement. Understanding your family history and adhering to routine screening criteria are the first steps towards obtaining an early diagnosis of colon cancer, which is crucial for improving treatment outcomes. According to clinical recommendations, those with average risk should start screening for colon cancer at age 45. Screening should begin earlier for people with a family history of cancer or other risk factors. Don't put it off. Test yourself right away. At Health Angel Solutions, our mission is to provide comprehensive information that empowers you to make informed decisions about your health. In this video, we're delving into the crucial topic of warning signs for colon and colorectal cancer. These cancers are prevalent and can be life-threatening if not detected early. By understanding the symptoms and risk factors, you can take proactive steps to protect yourself. Colon and colorectal cancer often begin with subtle signs that may go unnoticed. These warning signs include changes in bowel habits, such as persistent diarrhea or constipation, as well as the presence of blood in the stool. Unexplained weight loss, abdominal pain, and fatigue are also red flags that should not be ignored. By recognizing these symptoms early, you can seek medical attention promptly and potentially catch cancer in its early stages. It's essential to know the risk factors for colon and colorectal cancer. Age, family history, a diet high in red or processed meats, obesity, smoking, and a sedentary lifestyle can increase your risk. If you fall into any of these categories, it's especially important to be vigilant about monitoring your health. Don't put off taking action until symptoms worsen. Regular screening tests, such as colonoscopies, can detect precancerous polyps or early-stage cancer when treatment is most effective. Screening guidelines vary depending on age and risk factors, so it's crucial to discuss with your healthcare provider. At Health Angel Solutions, we want to empower you to take control of your health. By educating yourself about the warning signs of colon and colorectal cancer and understanding your risk factors, you can take proactive steps to protect yourself. Remember, early detection saves lives. Like, share, and subscribe to Health Angel Solutions for more valuable health information to keep you and your loved ones healthy and happy.